Hi, and thanks for joining today's literature recap. Today's abstract is titled, "The T2 Bacteria Panel Identifies 3 times more on-panel bacterial pathogens compared to conventional blood culture." My name is Oscar Guzman, and I'm the Vice President of Medical Affairs, and I'll be recapping this abstract today. This abstract was presented at the Society of Critical Care Medicine's annual Critical Care Congress in Phoenix, Arizona. And the abstract can be found in the Critical Care Medicine Journal, Volume 52-1, January supplement. Now, to provide you some background, the T2 Bacteria Panel is an FDA-cleared and CE-marked culture-independent in vitro diagnostic test that identifies common species that cause bacterial sepsis utilizing T2 magnetic resonance technology. The FDA-cleared panel detects Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumoniae, Pseudomonas aeruginosa, and Escherichia coli directly from whole blood within 3 to 5 hours. The CE mark panel also has Acinetobacter baumannii as a sixth target. The T2 bacteria panel has been demonstrated to be highly sensitive with a sensitivity of 90% and a limit of detection between 2 to 11 colony-forming units per ml. The T2Dx detects intact pathogen cells, both active and non-proliferating stationary cells. The purpose of this study was to quantify the rate at which T2 bacteria panel detects on-panel species compared to blood culture in studies evaluating the T2 bacteria panel. The T2Dx instrument is a fully automated multiplex instrument that utilizes T2 magnetic resonance detection in a self-contained benchtop system. Bacterial species identification occurs within 3 to 5 hours after sample loading. Now, this process occurs independent of blood culture, which may take anywhere from 1 to 5 days for final species ID. In terms of study methods, publications, presentations, and abstracts evaluating the T2 bacteria panel were systematically screened and included if they reported organism-level data for both the T2 bacteria panel and conventional blood cultures. Studies were excluded if organism-level data were not available for both on and off-panel organisms. And we also excluded data relating to T2 candida. The primary outcome is the ratio of on-panel organisms identified overall by the T2 bacteria panel compared to conventional blood cultures. Next, we'll go over the results. Table 1 highlights the studies included in the abstract. There were 14 studies included. On the table, you can see 5 columns including the primary author, blood culture method, location of the study, and study population. As you can see, studies ranged between 2018 and 2023 and were conducted in the US and outside of the US and included various populations including general, pediatric, and surgical ICUs, as well as hematology, oncology, and emergency departments. The next table I'll present is Table 2, time to pathogen detection and ratio of T2 bacteria panel versus blood culture pathogen detection. On the table, you can see 7 columns, including the primary author, the number of T2 bacteria positive cases, time to species ID with T2 bacteria, the number of blood culture positive cases, time to species ID with blood culture, the difference in time between blood culture and T2 bacteria identification, and then finally the ratio of T2 bacteria positive cases versus blood culture positive cases. In total, there were 604 bacteria positive cases and 198 blood culture positive cases for a ratio of 3.05. The mean time to pathogen ID with T2 bacteria was 4.6 hours versus 53.6 hours with blood culture for a time difference of 48.5 hours. This figure depicts the additional BSI-causing pathogens identified with the T2 bacteria panel compared to blood culture broken down by species. The blue columns depict T2 bacteria detections, while the orange columns depict blood culture detections. You'll also notice that Acinetobacter baumannii is included in this figure, and that's because at the time these studies were conducted, the T2 bacteria CE marked panel, which is mainly used outside of the US, did include Acinetobacter baumannii. That said, I do want to point out that Acinetobacter is now also included in the FDA-approved panel. Table 3 highlights the T2 bacteria panel analytic performance As you can see, the T2 bacteria panel performance was 89.9% in terms of sensitivity with a confidence interval of 84.8 to 93.72%. Specificity was 97.34% with a confidence interval between 97.08 to 97.59%. Now, to summarize the results of this analysis, across 14 studies, there were a total of 2,998 T2 bacteria panels tested. 1,511 were tested in the U.S., while 1,487 were tested outside of the U.S. The primary blood culture test methods included the BACTEC, BactAlert, and VersaTrex systems. And overall, T2 bacteria identified 406 additional pathogens versus blood culture, and the T2 bacteria panel had a sensitivity and specificity of 89.9 and 97.3%. One additional point that was examined was the incidence of false positives. We were able to find that for studies that were describing complete or partial adjudication of the T2 bacteria results, which included 8 studies, at least 85.5% of these infections were deemed true infections by the investigators. So, in conclusion, the highly sensitive T2 bacteria panel identified 3.05 more on-panel organisms directly from whole blood within 4.6 hours compared to conventional blood cultures at 48 hours across 14 clinical studies. The T2 bacteria panel has the potential to improve care by allowing clinicians to optimize antibiotic therapy through added identification of bloodstream infection causing pathogens that otherwise were missed by conventional blood culture. Future studies are needed to evaluate the impact of these added detections compared to conventional blood cultures. These are the references in case you wanted to go back and review the studies that were included in this analysis. And that's the recap for today. We hope you enjoyed this review and look forward to additional literature recaps in the future.